Hello everybody. Welcome to No1doctor YouTube channel. Today we will discuss urethral injury with one of the best urologists in the world, as part of our playlist called Common Surgical Problems. Welcome, doctor.
Welcome to you and your channel subscribers.
A male patient aged 20 years steps over a loose manhole cover. He falls only to be stopped by the edge of the everted manhole cover hitting him between his legs. Since then he is unable to pass urine. How will you manage?
If patient of road traffic accident management will be as per ATLS protocol. Primary survey and resuscitation. Secondary survey. Definitive management. If simple fall and hit by a manhole cover, it is usually a localized injury involving the bulbous urethra. In patient with pelvic fracture, usually the membranous urethra is ruptured. Detailed history. About the nature of the accident. Time of accident. Whether passed urine or has the urge for passage of urine. Any hematuria or bleeding per urethra. Any swelling in the perineum. Any symptoms related to other associated injuries. General survey. To assess presence of shock, particularly in presence of fracture pelvis. A head-to-foot examination in patient with road traffic accident to exclude any associated injury. Local examination. Any perineal hematoma. Diffuse swelling in the perineum suggestive of extravasation. Any bleeding per urethra. Abdominal examination. To exclude any associated injury. Tenderness in abdomen. Free fluid in abdomen. Urinary bladder full or not. Per rectal examination. Position of prostate. Fluid in rectovesical pouch.
Doctor, what is triad of urethral rupture?
Blood at the urethral meatus. Inability to urinate. Perineal hematoma.
Doctor, what are the types of urethral rupture and how will you differentiate?
Urethral rupture may be partial, complete. It is difficult to differentiate a partial or complete rupture clinically. This may be diagnosed by retrograde cystorthrography. In case of incomplete rupture, there is extravasation of the contrast, but some contrast passes into the bladder. In complete rupture, there is extravasation of the contrast and no dye passes into the bladder.
Doctor, how will you treat a patient with suspected rupture urethra?
If rupture urethra is due to an associated fracture pelvis, then patient will be in shock. Resuscitation with intravenous fluid, blood transfusion. If rupture urethra is suspected, patient is discouraged to pass urine. A retrograde cystourethrogram is done to assess the type of urethral rupture. If there is complete rupture of urethra, a suprapubic cystostomy is done by percutaneous puncture. The definitive repair is planned after 3 months. In cases with incomplete rupture of urethra, a gentle attempt is done to pass a 16 French Foley's catheter through the urethra. If the catheter can be passed successfully, patient is re-evaluated after 6 to 8 weeks. If urethral catheterization fails, a suprapubic cystostomy is to be done by percutaneous puncture method.
Doctor, how will you evaluate the patient for definitive repair?
A descending cystourethrogram or a pericatheter ascending urethrogram is done to assess development of any urethral stricture and distance of the urethral defect.
Doctor, how will you treat traumatic urethral stricture?
The defect at the rupture site is bridged by scar tissue. The urethral stricture may be managed by endoscopic internal urethrotomy, suitable for short segment urethral stricture. Open surgical repair of urethral stricture. Anastomotic urethroplasty is the procedure of choice. The site of the urethral scarring is approached through a perineal approach. The two ends are dissected and the scar tissue is excised. The ends are spatulated and an end-to-end anastomosis is done. An indwelling Foley's catheter is kept for 2 weeks.
Thanks, doctor, for excellent informations. Thanks for watching. Hope to see again in next videos, but do not forget to like and share this video. With my best wishes.